Happy morning dear students. Today's topic is patent ductus arteriosus. This patent ductus arteriosus condition comes under the congenital heart diseases or congenital malformations. These are the conditions are left to right shunt conditions. This is acyanotic condition, patent ductus arteriosus. Okay, here increased pulmonary blood flow conditions also is there. Okay, what is patent ductus arteriosus means? Here the artery, aortic aorta is there. This is ascending aorta, this is descending aorta. What happened here? The patent ductus arteriosus means there is an communication between the pulmonary artery and then aorta. Here this is the pulmonary artery. Actually here the pulmonary artery is having two branches. What happened here? This descending aorta is having communication between the pulmonary artery. Okay, during internatal period it is there, but when the baby is delivery, that automatically closed this patent ductus arteriosus. What happened in this condition after birth? This opening is like a defect after delivery only. Okay, so it is called as it is a congenital malformation of heart, that is patent ductus arteriosus. Means there is a communication between the descending aorta and in between the pulmonary artery. So what happened here? The pulmonary artery is having deoxygenated blood. This aorta is having oxygenated blood. So what happened here? The oxygenated blood again enter into the pulmonary artery. So the overload of the blood overload, the pressure is overload in the lungs is there. So here this is happening in the patent ductus arteriosus. All of you clear? This is then left to right shunt. Okay, here this is this condition comes under the left to right shunt and increased pulmonary blood flow condition is there. In this condition, child is not having any cyanosis. So it is an acyanotic condition. All of you clear? Coming to the introduction. Here, the ductus arteriosus is a normal fetal connection between the left pulmonary artery and the descending aorta. That is, normally it is there in the during intranatal period. During fetal life, blood flow is shunted away from the lungs through the ductus arteriosus and directly to the systemic circulation. It is there in the during intranatal period. What happened after delivery? In the patent ductus arteriosus are common in the premature neonates who weight less than the 1.500 grams or 1500 grams. Okay, those children, because they are delivered before prematurely. So the patent ductus, it is an open, it won't close. Okay, mostly these conditions, patent ductus arteriosus condition, mostly we will see in the preterm infants, those weight is less than the 1500 grams. They account for 5% to 10% of congenital heart defects, excluding the premature neonates. Okay, this is about the introduction of patent ductus arteriosus. All of you clear? And coming to the pathophysiology and the etiology of patent ductus arteriosus. During the fetal life, the ductus arteriosus allows blood to bypass the pulmonary circulation. That is, fetus receives oxygen from the placenta and flow directly into the systemic circulation. What happened during intranatal period? Okay, here the lungs was not working properly because the purification of the deoxygenated blood in the lungs normally we have, but during the intranatal period, the fetal circulation, the oxygenated blood comes via the placenta. What happened? Just there is an ductus arteriosus communication is there. What happened in the patent ductus arteriosus? Here the descending aorta is having communication with that pulmonary artery. So here the placenta was after delivery also that opening will be there. Here after birth, the ductus arteriosus is no longer needed. So now lungs has to work. The ductus arteriosus was not needed because after delivery lungs has to be work to purify the blood. Okay. But what happened in this condition? The functional closure usually occurs within 48 hours after the birth. That ductus arteriosus, within 48 hours that closure, the functional closure will be there. But what happened? Anatomical closure is completely by the age 2 to 3 weeks. When the ductus arteriosus fails to close, blood from the aorta, that is high pressure, flows into the low pressure, that is pulmonary artery, resulting in pulmonary overcirculation. Again and again the purification will be there. So it may leads to the pulmonary overcirculation. Increased pulmonary blood flow leads to a volume overload in the left ventricle is there. Okay. So this is about the pathophysiology of patent ductus arteriosus. I will explain again. During intranatal period, this patent ductus arteriosus is remain open. But what happened? Why it is open during intranatal period? Because the oxygenated blood comes through the placenta. There is no workload in the lungs. Okay. During intranatal period. So oxygenated blood comes through the placenta. Here the ductus arteriosus is having opening. When baby is delivered or when the baby is immediate after birth, within 48 hours or within first to 3 weeks, this ductus arteriosus will be closed. But what happened in this patent ductus arteriosus condition? Mostly these conditions is present in the premature babies because they are premature. That closing is unable to close properly in premature babies. So what happened? It is remain. Okay. So pulmonary overload is there because of again and again the recirculation will be there. So the pulmonary overload is there. This is about the patent ductus arteriosus pathophysiology. All of you clear? Coming to the clinical features or clinical presentation of patent ductus arteriosus. If it is small or small to moderate size of patent ductus arteriosus, usually asymptomatic. We should not identify those children is suffered with this patent ductus arteriosus if it is small. If it is large patent ductus arteriosus, the child is having with the congestive heart failure and tachypnea, frequent respiratory tract infections, poor weight gain, failure to thrive, feeding difficulties, decreased exercise tolerance. These are the clinical features we will see in the if it is large patent ductus arteriosus conditions. Okay, whether coming to the diagnostic evaluations, whenever we are doing the auscultation, the continuous murmurs hard, best at the left upper sternal border, hyperactive, precordium with the large patent ductus arteriosus we will heard. Okay, here where we will heard this continuous murmur hard sounds means in the upper sternal border. Okay, that is left upper sternal border we will heard the murmur sounds, and wide pulse pressure also is there. Here the pulse pressure, the wide pulse pressure is there, the bounding pulse pressure also is there, the bounds. Okay, whenever we are checking the pulse rate, the bounding pulse is there. Okay, these are the clinical features we will see in the patent ductus arteriosus conditions. And coming to the chest x-ray, next diagnosis, chest x-ray, it varies normal or cardiomegaly with the increased pulmonary vascular marking is there. And coming to the ECG, it varies the normal or left ventricular hypertrophy is there because overload is there. No, so left ventricular hypertrophy we will identify whenever we are checking the ECG. And next coming to the two-dimensional echocardiogram with the Doppler, the study and then color flow mapping to visualize the patent ductus arteriosus with the left to right blood flow is there. So we are discussing this left to right shunt. No, here the child is suffered with the patent ductus arteriosus, that is left to right blood flow is there. Okay, and cardiac catheterization is not needed for the initial diagnosis. And coming to the management, in the symptoms is premature neonates. That time we will check for the indomethacin given, that IV route we will give. If it is asymptomatic, or if your child is suffering with the low birth weight or preterm baby, that time we will give indomethacin IV medicine we should administer. And coming to the medical management, that is monitor the growth and development and reassess for the spontaneous closure of patent ductus arteriosus, and increased caloric intake as needed for the normal weight gain, because those children are premature children, no? So they need increased caloric intake. And diuretics also is administered, that is furosemide, Lasix, and then spironolactone and aldactone. These are the drugs they are using for the management of diuretics. And the next one is infective endocarditis prophylaxis for the 6 months after surgical intervention they are giving for the coil closure. Here the surgical intervention is for the patent ductus arteriosus is coil closure. Okay, here look at this image. Here this is the coil to close the where the pulmonary artery and then descending aorta is open. Here look at this image. This surgical intervention is a coil closure. Mostly through the cardiac catheterization they are doing this surgery. Okay, coming to the cardiac catheterization, for small patent ductus arteriosus coil closure is doing, and for large patent ductus arteriosus a closed device may be used. They are using some closing devices. The surgical management through the patent ductus arteriosus is ligation. They are ligate that part where the hole is, the communication is there between the pulmonary artery and then descending aorta. Okay, this is about the surgical intervention of patent ductus arteriosus. Coming to the complications, here the complications of patent ductus arteriosus is congestive heart failure, pulmonary edema, infective endocarditis, and then pulmonary hypertension, pulmonary vascular occlusive diseases also is there, and recurrent pneumonia, because the oxygenated and then deoxygenated blood both are mixing. The lungs is having more pressure, so the pulmonary edema is there, so automatically child is suffered with the pneumonia, recurrent pneumonia or recurrent upper respiratory tract infections. And this is about the patent ductus arteriosus. All of you clear about patent ductus arteriosus? What is patent ductus arteriosus? It is a communication between the pulmonary artery and then descending aorta. This condition is left to right shunt condition. Mostly these conditions comes under the cyanotic conditions. In these conditions child was not having any symptoms of cyanosis. All of you clear? This is about the patent ductus arteriosus.